Back to that COVID-19 surge. More than 2,500 Ohioans are hospitalized right now because of COVID-19. Nearly 175 of those patients went to a hospital in just the last 24 hours.
Ohio Governor Mike DeWine and his team telling Ohioans if residents don't start taking this virus seriously, adhering to safety guidelines, it will result in a serious strain on healthcare workers. News 5's Jesse Schultz spoke to a nurse who describes what the demand has been like as she cares for COVID patients, and her story comes with a warning. Jesse?
Yeah, right now there are enough beds, PPE, and ventilators, but the main concern is doctors and nurses getting the virus while they're out in the community. Health officials saying if we continue on this path, there may not be enough healthy staff members at the hospitals to deal with this COVID-19 surge. Sade Khan Butler lives in Cleveland and has been a traveling nurse for 3 years. She gets dispatched to COVID units all across the country.
Overall, it's pretty terrifying. You're thinking about taking care of someone, but also in fear for your life because you also don't want to contract the virus.
She says when the virus first hit, doctors and nurses were just trying to stay afloat.
It's just like keep them alive and hope for the best. That was it. It was very hopeless.
And while the first couple months on the front line was a day-to-day struggle,
the patient gets really sick really quick. So it goes from you're fine, until you're not fine. And then you're really, really not fine. And then this could be the end.
She's worried now about what lies ahead. People having COVID fatigue and letting their guard down, contributing to spread.
I just wish other people would do their part.
Right now, 300 Cleveland Clinic workers are not reporting to work because they either have COVID-19 or are quarantining. The clinic says it's seeing caregivers contract the virus in the community, not in the hospital.
I want to emphasize that if we don't see a shift in the way things are going, meaning if we don't control the spread of the virus and our case numbers, we won't be able to continue caring for the acutely ill without postponing important but less urgent care.
Health officials echoing her sentiments, saying it's not time to let up.
So now is the time to wear a mask and socially distance. If not to protect your family, your friends, and your community, then help protect the caregivers.
Butler's job is to help people and go to the places that need her most, those hospitals with staffing shortages. She's taking precautions she needs to make sure she stays healthy to continue to do that. But she just asks that everyone else does the same.
And we just have to be patient as a culture. We want everything to be instantaneous and we're tired of being locked away. But it's just like, if the nurses become sick, then who is going to take care of the sick?
Again, health officials stress that these caregivers are not getting sick in the hospital, but rather out in the community. They say now in the next coming days and weeks is when we really need to limit those gatherings. Reporting in Cleveland tonight, Jesse Schultz, News 5.
And we thank you, Jesse. Cuyahoga County judges voted